Hello guys, I hope you're well. So another question I get asked quite a lot is, what does U=U stand for? What does it mean? Now, it stands for undetectable equals untransmittable. And what that means is if you are living with HIV and are on medication, ART, which stands for antiretroviral therapy, that will bring down the amount of the virus, the HIV virus, in your blood to undetectable levels, which then means you cannot transmit HIV. It's impossible. So if you're on treatment like myself, I take one pill a day. That's another thing. People seem to think that I'm on a concoction of tablets. I'm not. I take one tablet every day, and I take that at 8:30 every night. That's another thing that's important: adherence to the medication, to make sure you take your medication every day and on time, which then keeps HIV at undetectable levels in your body, which means then you cannot transmit HIV. It is impossible. So this is my medication, Biktarvy. And another thing I would highly recommend if you are on ART is to get one of these. So you've got a little container for every day, so that you know without fail that you have definitely taken your medication. Now, I've never missed a pill, but I have double dosed on 2 occasions because I couldn't remember if I took my medication. So one of these I would definitely highly recommend. Then you know 100% if you've taken your meds or not. So another question I get asked is, well, if the virus is reduced to undetectable levels in the body, how is HIV still being passed on? Well, it's not being passed on by people who are on ART, like myself, because the virus is taken down to undetectable levels in the body. And I've been undetectable since I was diagnosed in October of 2021. I've not had any blips. So I've not had any. Basically, a blip means that you become detectable again. But for most, you might go up from undetectable, is down to anything below 40 copies. So I've been undetectable for 3 years since my diagnosis, but there are some people who have the occasional blip, they call them, where you will become detectable again. You might go up to 200 copies, but it's still not enough to pass on HIV. Now, the reason HIV is still being transmitted is because in the UK there are around about, I think, 100,000 people thereabouts who are living with HIV that know they have HIV. But there's also an estimated 5,000 people in the UK who are living with HIV but don't know they have HIV. Now, for those that don't know, for many who contract HIV, there is 0 symptoms, none whatsoever. Myself, I did have symptoms, but I didn't know what they were. I just put it down to getting older and, other health conditions like acid reflux I got, rashes on my body, which I put down to psoriasis because I have had psoriasis in the past. I did actually go to the doctors when I was getting these symptoms, swollen lymph nodes, things like that. But they didn't seem to think I needed to be tested for HIV. Not that I asked anyway, but they thought it was down to just some infection in the body and getting older. When I was diagnosed, I was 42 years old. I'm currently 44. So yeah, stigma is another reason as well why people aren't getting tested. They're terrified, understandably, because of the stigma that's associated with living with HIV, the guilt, the fear, the shame, that's all wrapped up in them 3 letters HIV, which shouldn't be now in 2024. HIV has moved on, but unfortunately the stigma that is attached to HIV is still stuck in the past. And that's why I'm doing what I'm doing, to try and educate and just show the facts about HIV. So that's some of the reasons why HIV is still being transmitted. There's other reasons as well. In poorer countries, people don't have access to treatment. They aren't blessed like we are in this country. where we get very good care. You know, the UK is one of the leaders in HIV treatment. So this is why it's important to get tested. Don't think that because you're in a particular group of people that you're not vulnerable from contracting HIV, because HIV knows no boundaries. HIV does not discriminate. You know, anybody is susceptible to catching HIV if you are having sex, you know, which is a normal human function. So that's what U=U means. Undetectable equals untransmittable. So if you are on effective treatment and you have an undetectable viral load, you cannot pass on HIV. So I hope that helps. Hope that answers some questions for you guys. Hope you have a fantastic day, and I'll catch you in the next one. Also, one more thing, if you're watching on YouTube, please subscribe to my channel. Please like the video if you like it. Please share it, and press that notification bell as well, so when I do post a video you get alerted to that. So I appreciate all your support. Thanks very much guys, and I shall catch you in the next one. Take care.